attending today's meeting to make sure that we had a quorum. Welcome to the Health Commission Finance and Planning Committee meeting for November 3rd. And Miranda, you're going to read the land acknowledgement for us.
Yes, and first I'll call roll.
Oh, that's right.
Commissioner Guillermo.
Present.
Commissioner Jurado.
Present.
All right. Before I read the land acknowledgement, I just wanted to say for folks that are in the room, the HVAC system is very loud. So please speak loudly and enunciate. And if you have trouble, commissioners, if you have trouble hearing, please ask presenters to repeat, and same on the other side. If you're having trouble hearing the commissioners, please let us know. Okay, I'll read the land acknowledgement. The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who are the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land, and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community, and by affirming their sovereign rights as First Peoples. So the second item on the agenda is approval of the October 6th Finance and Planning Committee minutes.
Okay, we have the minutes in front of us. If I can have a motion to approve.
So move.
Now second.
All right. And is there any public comment on the minutes?
Any online? Okay.
There's no public comment, so the minutes are approved. And the next item is the monthly contracts report.
Okay, thank you. And Ms. Baker, you're going to take us through that. Thank you.
Yeah. Okay. So we have quite a few items to get through today. Kim Baker, I'm the Director of the Office of Contract Management and Compliance. And first of all, I wanted to start out with an apology. If those of you have may not met Murphy's Law really struck today. We got ready to start working on the reports and realized that somebody had inadvertently changed all of the contract numbers on all of the reports to the exact same contract number. So we don't know what that was about or why anybody would possibly do that. We think maybe somebody was doing a search and replace and accidentally did that. So we've provided you with fresh copies to try to correct that. And there were a few other little typo related things that I found this weekend when I was going through to prepare for today that I will point out to you just to make sure that the public and everybody has the correct information as we go through these items today. So we have before you, we're going to be talking about 16 items today, 14 on the monthly report, and then 2 will be new contracts, one of which I will be covering today. There are 11 amendments and 3 continuing services in new contracts on the monthly report today. So we'll get started. The first item that you have is an amendment, and it is with Crestwood Behavioral Health. And this is an increase to the contract by $33.2 million for a total revised contract amount of $42.3 million. It's going to extend the term by 3 years and 8 months. And it's to continue to provide for a 16-bed voluntary crisis stabilization unit that operates 24/7 and is located at 822 Gary. So this annual cost reflects a slight 3% increase, and that's primarily just for the cost of doing business. And the crisis stabilization unit provides immediate voluntary medical care for people with urgent mental health and substance use needs. This is cost reimbursable currently, but it is going to be moving to a fee for service. It is funded through Prop C, 100%. This falls under our bed ordinance, and it is monitored by the Business Office of Contract Compliance. However, because this was a startup year, we do not have a monitoring report for this one yet. Any questions about Crestwood?
Thank you. Yes, Commissioner Gerardo.
Since I'm new on the committee. Yeah, oh, it's not. There. Um, Could you explain to me, as I was going through these contracts, how you calculate the cost of doing business per contract?
So, yes, thank you for, I know you had sent us a question earlier. And so basically, it's determined annually and budgeted by the CBOs equally. And through the mayor's budget proposal, these numbers are set. And it's based on some changes in the CPI and funding availability. So the CPI might be higher, but it also is based on funding availability. And you'll see that most all of the contracts have anywhere between like a 1 to 3% cost of doing business increase when these amendments come about.
Is this standard for all departments' contracts?
It's standard for the CBO related contracts,
Okay, so it's just
community
focused
based.
on
Mhm.
CBO contracts?
Yes, that's correct.
Okay,
Yeah, you won't see it on like the health network. They may have like a CPI built into their contract, but this is how these particular contracts are handled.
okay. And so with the cost of doing business and then the proposed annual amount without contingency, can you explain that to me?
Yes, all of our contracts are allowed to have a 12% built-in contingency, and that is allowed to be used to do changes to the service that may be needed over time. So that contingency is built into the contract amount, but the CBO does not have access to it unless we authorize access to that money, but it's already built into the cost of the contract.
So it's built into the cost of the contract.
Mhm.
But then, for example, with Crestwood, with the 7,695,000, which is the proposed annual amount
Mhm.
without contingency,
Yes.
into the total amount of the original contract, this was in the total amount of the contract?
The 12% is in that
Per-
amount.
That's per year or per
The
contract?
12% is overall contract value.
It's overall?
Yes.
Okay. And so with Crestwood, it's for this year, but not for the proposed contract term. For the proposed contract term, which goes to 2030,
Mhm.
would it be again, or is it just for this year?
Are you talking about the
The-
cost of doing
the
business
7 million
increase?
No, both, the 7 million and the cost of doing business.
So the
Because
cost,
when we're looking at budgets
Yeah,
and what's
right.
going on.
Yeah, so the cost of doing business is factoring into the annual cost.
Okay.
So every annual cost is at the 7.6. And then the 12% contingency is built into that total $42 million that you see there. There'll be a 12% contingency in there. And it takes a formal document. It's called a revision to program budget that is done to move money from the contingency into the contractor's contract or the CBO's contract. So it's a formal document. It's signed off by our side and by the CBO side to actually shift that money from the contingency bucket into where they can actually use the money in their contract. It'd be documented with the reasons why it was being moved and so forth.
Okay. And I don't mean to, I just wanted clarifications for me going forward.
Yes,
The COB is an annual cost for the CBOs,
Yes,
right?
that's correct.
But that 12%
Mhm.
is not for the CBOs.
It's built into their contract, but it's money that is for us to authorize with the CBO should it be needed. So if it's not ever needed, the 12% would just come back to us, come back to the budget. It stays in the budget. and it has, like I say, it has to be formally used through a document to be able to be put in for their use, even though it's sitting in their contract and it's part of the 42 million.
Okay.
There's a 12% sitting there that they can't touch unless we say, oh, you can touch it with a formal document.
Got it.
Okay.
So this contract today
Mhm.
is the 12% you're authorizing
The 12% is authorized in that total of 42 million.
by you, by your group today for now.
Yes.
Okay, thank you.
You're welcome. All right.
Okay.
Ready to move on?
Actually, I had a question.
Okay.
So I know that there is no monitoring report for this because it was a first year, but and I know that we've heard about the performance on this or some of the successes both in the media and in at the commission. But just wondering if there is anybody here who could sort of speak to how well the program or not.
Yeah, sure.
In
Emmy,
terms of the
Emmy
initial
is,
year.
Is he behind you? Okay. Oh, here he is.
Good afternoon, everybody. My name is Emmy Garcia. I'm the program manager for this contract. Is there any specifics of the information I could provide anecdotally or?
Well, I don't recall from the initial authorization, like what the performance indicators were
Oh,
for the
gotcha.
outcomes, but just sort of looking at just a generalized sense of how well things are going since we're being asked to approve this for another 5 years.
Perfect. So in our contract with Crestwood at this project, what we're really looking at specifically on the clinical side is we're trying to make sure that we have good outcomes for the clients. Specifically, one of the purposes that these programs serve in our community is that we make sure that we get people from the streets into the right level of care. So one of their metrics is that they're able to get people who they engage with no more than 30% of those people into the hospital within X amount of time. Specifically, what that means is that if somebody they see is gravely disabled or needs a hospital level of care, that they're able to move that quickly beyond keeping them for too long in the community. So we did just, of course, this is a little bit anecdotal. I don't have the data in front of me, but we did get asked this recently. And I believe they were at 2% in terms of people who stayed a little bit longer before going to the hospital, while our metric was 30% in alignment with some of our other projects. So they're doing very well on that front. Another issue or another data met point that we have for them is really just that everybody who gets served by the CSU gets a comprehensive psychosocial assessment. And the tool we have there is we're making sure that anybody who's there for longer than 12 hours, and 12 hours accounts also for people who come in crisis in the evening and may like sleep overnight, that they get this comprehensive assessment before they get discharged. We also found that data was very favorable. We only had a couple of issues from like week one when we first launched the program as they pertain to training of staff. But since then, they've been meeting that mark as well. So those are 2 data points that we have also on file with BOCC, and this will be measurable at the end of the year once we do the formal evaluation.
Thank you. And then there was initially concern throughout the neighborhood about the impact on the neighborhood from the Rice Center. So I was just wondering if we've been able to mitigate any of those concerns.
I can, from the DPH side, say that to my knowledge and to the knowledge of Eileen Laughlin, who's our community affairs officer, we've not heard any complaints from our immediate neighbors in regard to the project. If there's complaints, they've not surfaced to DPH.
Great. Thank you.
You're welcome.
Thank you. And I should have probably also noted for the record that the contract number is 10,35278 on this particular one. Okay. Our next contract, there's going to be a series of 7 of these Health Access Point HAP contracts. So I'll try to talk about it completely on the first one, and then the rest of them I will, for consideration of your time, I will talk about the individual CBO and how much we're increasing the contract, but the services and the scope are going to be the same. Okay, so we don't just repeat that over and over. So this very first HAP contract is with Asian and Pacific Islanders Wellness Center. And we are amending this contract to increase the contract by $4.8 million for a revised contract of $9.1 million. And this is a 4-year term. And it's to continue the HAP services, Health Access Point services, to meet the needs of the Asian and Pacific Islander and trans women communities. So each one of these CBO contracts has a different provider and it will be serving a different population. So I'll try to make sure I hit on that. And again, this is contract 10,24731. We did make an update on that. So this one has an increase to the cost of doing business, and that is a 1% increase for this particular contract. So the HAP services are designed to meet the needs of people who use drugs, and it covers a wide variety of programs. And I should also have mentioned that I have Nicole on the line here, and she handles all of these programs, and so she can certainly chime in if there's anything specific you need to know. But basically, it covers all of these things. It covers integrated HIV, HCV, and STD testing, linkage and navigation, care and treatment, harm reduction services, overdose prevention, syringe access and disposal services, condom distribution, community engagement and mobilization, HIV, HCV, STD, health education and prevention counseling, basic needs services such as hygiene supplies and food, preventative and treatment medication, mental health services, primary care services, and substance use treatment. And there's also one other contract that has capacity building, so I'll try to point that out when we get to that particular contract, but they all pretty much follow this same model. It's a cost reimbursable contract. It's 100% general fund. And this particular CBO has been monitored by the contract compliance group and has received a score of 4, which is the top level score, commendable or exceeds standards. So any question about that one before I move on into the other 6 that are just
you.
like it?
Thank you, Kim. Are there any questions?
Okay.
I actually had one. So
Yes.
there was a delayed audit, which apparently has been fixed, but I'm just wondering about whether the staffing has been stabilized at the finance department so that we
I
don't see-
believe so. Did you want to speak to that at all? Anybody have any additional information, Nicole, or anybody on that?
I don't have any additional information as of right now regarding AHP's finance department. I know they had moved forward with some hiring of some new staff members.
Okay, just as sort of the future in case that becomes an issue again, if we can just be notified in advance.
Yes.
Okay.
Okay. Yes, absolutely. Okay, the second of the HAP contracts is contract 10,24732. And this particular contract is an amendment with Rafiki Coalition for Health and Wellness. And this increase to the contract is $11.4 million for a total increase, revised contract of $20.8 million. This is also a 4-year term for HAP services. And this one is also subject to approval by the Board of Supervisors. That's why you see all of this group of contracts coming to you early, because a lot of them are exceeding the threshold to go to the board, and we need time to get them to the board so that we have them all in place when they need to start up next year. This one also has a slight 1% increase to the annual budget for the cost of doing business. The services are the same as we talked about before. And this particular one, although your report may say that they received a 4, there were actually some changes to their scoring, I believe, kind of late in the game. And Nicole, I don't know if you had any additional information that you wanted to talk about with Rafiki on the monitoring?
Yes, sure. Thank you, Kim. So that's correct. In the original report, there was a score listed as 4, but again, we changed those scores for reasons. They are reported to have a score of a 1. They've done extremely well. I do want to point out that Rafiki has done extremely well on their program delivery as well as the implementation of their services. However, we found that during the monitoring visit, there needs some improvement on the administrative oversight and timely submissions of the invoices. So essentially, this particular monitoring report received a 1, primarily due to no submission of the last invoice. And we used the last invoice to essentially calculate the deliverables for Q4. Rafiki has now submitted their last invoice to fiscal. However, it just wasn't submitted in time for the Health Commission, and nor was it submitted in time for the BOCC monitor to complete their report. We are now in the process of issuing a plan of action requirement to address these issues separately. And we're also providing the agency some technical assistance plan. We've been working with the agency closely, providing capacity building and support, internal and external. So we do believe that they have the ability to do better. Like I said, they do really great programmatic work. And so we still would like to recommend continuing these services and improving the contract moving forward, of course, with the exception of the plan of action in place.
Yeah. Oh, you go ahead. No, you had a question? Yeah.
I think we have the same question.
Yeah. So we do have a couple of questions here. Actually, the summary of the performance monitoring report shows no scoring at all.
Right.
Even though the final report we don't get those anymore, but we don't have any scoring at all. And so that's something that I think we need to be able to show to the full commission before we recommend
Okay.
approval. And then in terms of the plan of action, one of the points in the fiscal compliance note was that the board had not approved the budget for 25-26. And so I want to make sure that the board has approved the budget and that the board is actually meeting in time and, doing the governance that is necessary to make sure that the agency is going to continue to do the good work.
Right.
Because we wouldn't want to have either governance or internal management issues
Right.
impact the programmatic
Okay.
work.
Thank you. That's
Yes. So, so is your question, has the board approved the budget? Is that what your question?
Yeah, that's one of the questions. And the other is we
Is
need to see
the
either
monitoring.
some sense of the plan of action and or the summary of the scoring that is related to the plan of action.
Okay. Okay. Got it.
Those were my questions, in that I wasn't comfortable with what had been presented to send it on to the commission.
Okay.
Did Wasim have something?
Do you have can you address the board part? Okay.
Oh, hello. Good. Hello, Wasim Samara from the Fiscal Monitoring. So we haven't done the new monitoring yet. It will be coming up in the first quarter of the calendar year, so January, February, March. And obviously we will be looking at that, but we did, discuss that with them, and they did assure us that, next time they will have that approved timely. Their board does meet about finances. They met some other standards, like for example, that they review the just the finances. But I think just the specific one, the budget one, they were late on approving that. But we will be checking on that definitely in the next year. And if it's a repeated finding, then that's when they get some kind of corrective action plan.
Is that going to be in the plan of correction or plan of action, the follow-up on the board governance with the budget?
If they have the finding again, then there will be some like tier 1 corrective action plan, which is, I think, separate from the other corrective action plan that the program folks was discussing.
So if it's possible for us to get the plan of action prior to the full commission meeting, just a copy of that, just so that we can see something, because it just, otherwise it's all blank. So
Nicole, do you know if we can get our hands on that before the full commission?
I can check with the agency for sure. What date is the full commission on this Wednesday?
It's today, right? At 4?
At
4 o'clock.
I will try, but
yeah,
I'm not confident that I will be able to get that to you today by 4 o'clock.
Yeah, go ahead.
Even if it was verbal, that you have spoken to them and what their timeline is for plan of action, and if in fact you are confident and comfortable with that, then, we would be too. But
Yeah, understandable.
Because
So
we're aware
we,
that there's a timeline issue with
Yeah.
getting it in front of the Board of Supervisors, and so we don't want to postpone it.
Right,
But we
Right.
need to have some
right. I
assurance
totally
that- yeah.
understand.
So as far as the plan of action for the programmatic side, we are confident in that. We have had conversations with them. They are aware of that plan of action. Regarding the board, their board of governance and approving their budget for fiscal year 25, 26. I know they have their meetings. I'm just not aware of when those meetings were and if it was approved or not, but I can try to get verbal um, confirmation if that has happened. But regarding the programmatic piece, we are confident that Rafiki will be able to execute on the plan of action, particularly with timely submission of their invoices, which calculate the programmatic deliverables. That was our main concern with this last invoice for quarter 4.
that'd be great if they could just give you a timeline. That's all. Instead, that their plan is to have it done within the next 10 days, 20 days, whatever that you would be comfortable with telling us.
So for the plan for the last invoice, they have submitted that already. So we had a deadline of last week. They just didn't get that invoice in by the time of the Health Commission. So they have
Okay.
satisfied that.
Okay, great.
Yes.
And then with the budget, again, if the board has not approved the budget, they can't operate, they can't expend funds. And so
Right.
that's a really important piece because we're already into the first quarter, going into the
Right.
second quarter of the fiscal year. So a verbal confirmation of the board approving the budget, because I would feel
Yes.
uncomfortable. Yeah. Okay.
Okay, I'll get that. I'll contact the ED after this
Thank you.
this meeting here. Yes, thank you.
Okay, thank you. Okay, so the third one, the third HAP that we have is item number 4, contract 10,24733 is an amendment with Instituto Familiar de la Raza and our IFR, as they're called. And this is an increase in the contract amount of 10.2 million with a revised contract amount of 18.1 million. This is also a 4-year contract to continue to provide HAP services. This one also has to get approval of the Board of Supervisors. It also has a slight increase, annual increase of cost of doing business of 1%, similar to the others. And their monitoring report is good. They received a score of 4. And that line should read, instead of the health access point, it should have said IFR received an overall score of 4, which is commendable or exceeds standards. Okay.
Any
And
questions?
this particular HAP,
Oh.
I should have mentioned, is for Latinx communities.
Thank you, Kim. Any questions? Just one on the fiscal and compliance report said that the auditor had been engaged. Was just wondering if it had actually started for fiscal 24-25. Okay, great.
So we did follow up with them, and they did mention that they're actually on track and finish it earlier than the 9 months. So they're expecting it to have it done by December. So they're on track to complete it on time this year.
So this is for fiscal year 24-25, or is it earlier? Because it says in the report that is for fiscal 24-25, and to me that would be it'd be actually early. If
So
they,
now they will be doing the audit for, yes, 24-25. Yes, we are in 25-26. Yes, so they'll be doing the audit for 24-25. So that is on track, the
Okay,
fiscal
great.
year 24-25. Yes. Thank you.
Thank you. Okay, so the next HAP item we have, we're actually going to move to next month. This is contract number 10,24734, and this was with the San Francisco AIDS Foundation. And the reason why we need to move it forward 1 month is you'll notice that it has a piece of work that is being authorized by Admin Code 2142. And we've been having a lot of discussions with our city attorney's office about the appropriate way to bring contracts using 2142 to the Health Commission. So they would like a little bit more time to finalize that process. And so they've asked us to move this to next month. So we're not going to talk about this one today. And you'll see it again in December. Okay?
Will this affect it going to the Board of Supervisors in time to be approved for?
Good question. I will definitely delay it, but I think we will still be able to get there before the end of the year. So we should be okay. Okay. So the fifth HAP is with Lavender Youth Recreation Information Center. And this is a contract amendment also. And it increases the contract by $2.3 million for a revised contract amount of $4.3 million. It is also a 4-year term to continue HAP services, and this is for young adults. It also has a slight 1% increase in the cost of doing business in the annual cost. And this one also has some compliance challenges as well. And I think Nicole was going to talk about this particular one also. Nicole?
Yes, thank you, Kim. So we are also requesting, although Lyric received a score of 1, we do have a clear plan of action in place. I've met personally with the ED and also the programmatic staff at Lyric. They were in contract compliance with their program declaration page as well as the items in their administrative binder. They do have a plan in place to ensure that one of the items that came up was there was some staffing that did not complete some of the annual training, which include some of the bloodborne pathogen training, the trauma-informed training, and there was some miscommunication around when a staff member started and their employment ended within the next, I think, 6 months. However, we require, regardless of the duration of a staff, that they complete those annual trainings. So there is a plan in place where staff are required to not only complete the agency required training, but the DPH required training within the first month of their employment at Lyric. And for fiscal year 24-25, there was an issue with the UOS, the units of service, where the agency mistakenly transposed the units of service that were in the Appendix B to their internal tracker. And so what they were tracking internally was not the accurate units of service. And we saw that there was a clear discrepancy between what they had internally and what was documented on the Appendix B. So in that case, we have rectified that situation. I am working with them personally to build out their Appendix B for fiscal year 25-26 and ensuring that those numbers are transposed correctly to their internal tracker, and also ensuring that the subcontractors that they have hired for some pieces of the work are also, those units of service are accurately detailed within their subcontractor agreement and also listed correctly in App B. So again, I'm confident that they're going to meet their plan of action requirements for this next fiscal year. They do amazing work. They create culturally appropriate responsive spaces for transitional age youth, and we want to ensure that those services are not disrupted.
Thank you, Nicole. Caution?
Thank you.
Yeah, I mean, I totally agree with what they do in their scope of service. But did they, again, give you a timeline of when their plan of action will be completed versus?
Yes.
Okay, and what was their timeline?
We're already starting on that. So they're completing their Appendix A. They're waiting Appendix B. They just received their new funding notification for fiscal year 25-20. I mean, for the upcoming fiscal years that we're adding these the extended years. And so that should be done within the next week or two. They're updating their budget appendices right now. And once the ED completes her portion, then I will review it for accuracy.
Okay,
Okay, so that'll be done before going to the board, the full
Yes,
board. I mean,
their
the Board of Supervisors.
Yes, their Appendix B will be developed, I'm sure, before the board meeting for all of the health access points. They just received their new funding notifications. Yes,
Okay.
Okay.
Thank you.
All
of
right.
course.
So moving on to the sixth item for HAP. And this particular one is Regents of the University of San Francisco. And this is Ward 86. And this is another contract amendment. It's going to increase the contract by $4.9 million, a revised contract amount of $9 million. This is also for 4 years to continue HAP services. And this is to meet the needs of people who use drugs and inject drugs. This one also has and this I should have mentioned, this is authorized in under our Administrative Code 1.25, which is our government to government agreements. And this one has also a 1% cost of doing business increase in the annual funding, just like the others. And on their monitoring, they received a score of 4, which is commendable, exceeds standards. Any questions for Ward 86?
Any questions?
No.
No.
Okay. So the seventh and final HAP contract that we have for you today is contract 10,024,737. This is Regents of the University of Southern California. And this one is the Alliance Health Project. There was a typo in your original report. It also read Ward 86. We know that we already did Ward 86. So this is AHP. And this particular contract is an amendment. It increases the contract by $3.6 million for a revised contract amount of $6.9 million. This is also a 4-year term to continue HAP services. And this particular one is for the Asian and Pacific Islander community. It is also a government to government agreement. It also has a slight 1% increase in the cost of doing business for the annual amount. And it also has received a score of 4, which is commendable, exceeds standards. So that's the last HAP. Any questions
I
about
just
that
have
particular one?
one on the sheet here. It's the Regents of the University. It's not the Regents of the University of San Francisco. So I think if this is going anyplace else, we've got the wrong place. Since it's the Regents of the University of San Francisco, UCSF, or what? How do you,
On the contracts report,
on the contract report?
Nicole, can you respond to that?
There are Regents of the University of San Francisco,
Yes.
and that's not UCSF. So I'm just trying to clarify for
It
the record. I know, but
It does read the Regents of the University of San Francisco. It
Yeah.
does.
I'm just for, at least the previous one says UCSF Ward 86.
Mm-hmm.
Ye-
Just-
Yes.
Just
Oh.
for clarification,
Yeah.
you know what I'm
Yeah.
saying?
The official program name that we use for the contract documents is as well as funding notifications and other program documents are UCSF Alliance Health Project.
Yeah.
And we distinguish that between UCSF Ward 86.
no, Nicole,
Yes,
the clarification is on the contract report. The contractor name is Regents of the University of San Francisco, not Regents of the University of California. So it's just
It's just a little administrative thing.
Yeah.
Right.
I
Since-
see. Okay.
That's all. I just
I
wanted to
apologize.
clarify. Yeah,
Got
Needs to
it.
be
Got
on
it.
there.
Got it. I see what you're saying. Okay.
just because I was a regent of the University of San Francisco. And I just want to make sure that this is correct for this.
Yes. Got it. Thank you.
That's all.
Okay. Make sure I'm on the right one. 77. Okay. So our next item, which should be item 9 in your packet, contract number 10,25225. This is a contract amendment with Victor Treatment Services to increase the contract by $5.9 million and revise the contract by a total amount to a revised total amount of $8.7 million. It's also to extend the term by 5 years to continue to provide short-term residential treatment for youth age 6 to 18. It's being brought forward to early because there was insufficient funding to support the contract through the original proposed term, and that's why it's here early. This one also has a decrease in the annual cost, and you'll see the reasons there. It looks like there were 3 different things that affected the annual cost. The 1% cost of doing business, which would have been an increase, a reallocation of some funding from another contract provider, and then reduction of some one-time funding for room and board client care that caused that decrease. The goal of this program is to provide integrated and comprehensive mental health, educational, and residential services to youth identified as needing short-term residential treatment program. This particular program is located in Santa Rosa. It's been in business doing business with us since 2017. It's considered a top performer in its class, and the average stay is about 6 months. This is a fee-for-service contract, and it is monitored by the Board of Contract Compliance, but the monitoring report is pending for this particular one. And I do have, I believe, Farah, and yes, Farah is on the line if you have any questions about the monitoring piece on this one, or anything else for that matter.
I do.
Okay.
With the Victor Treatment Services, is the short-term residential available only to San Francisco youth for start?
Our contract is for San Francisco County Medi-Cal youth, but Victor is located in Santa Rosa and serves, other counties and other youth. But for us, we're overseeing the placements of in coordination with our system partners of the San Francisco County youth for this contract.
Okay, so how many beds are there in the short-term residential unit?
That's a great question. We contract for 10 unduplicated clients a year, but I can check with Victor as to how large their residential program is. Most stay under 16 beds, but I would have to confirm with Victor.
Okay, so there's 10. DPH is for 10, is contracted yearly for 10 kids. Am I correct?
Yeah, the contract the contract in front of you for that award, it would be for 10 clients.
Okay, and then is this then coordinated with Child Crisis? How do the kids get referred to Victor versus Macaulay or Edgewood, which are in San Francisco? And I believe there's also a contract with John Muir. But what is the approach? Is it if Edgewood, I'm looking at the family since this is kind of what I do during the day. Are the kids sent to Victor in Santa Rosa if in fact the other beds in San Francisco are full?
Yeah, so I want to tease that apart because the other programs you mentioned, Edgewood and Macaulay's, do not have a short-term residential treatment program. So there's different layers to this. The short-term residential treatment programs across the state of California, all counties in San Francisco, the mental health plans and behavioral health work with our system partners. So child welfare, the foster care system, juvenile probation, and the school district, SFUSD, make the placements into residential programs. They're the placement agency. our contract is to integrate the specialty mental health services within those settings. So Victor is predominantly or completely a placement for child welfare, foster care youth, and SFUSD. And then, so they make the placements into those settings. Our contract covers the mental health services. In terms of the other placements, Edgewood, Macaulay has a CEEP, a counseling enriched educational program, and Edgewood also has
Right.
a CEEP, a counseling and enriched educational program. That's the highest level of care, like that would be the highest level of care within the school district before going to a residential like Victor's STRTP, short-term residential. But they have counseling and rich educational programs. The only other short-term residential program in San Francisco County that we contract with is Catholic Charities, who has a boys' home for
Same.
kids specifically on probation.
Yeah, that's St. Vincent's, I believe. And so then does Victor have a IOP program? Where do the kids go after the residential? If they're there for up to 6 months and they need so-called aftercare?
They could
in
be
the-
there, yeah, they could be up there up to 18 months. It's designed to be around 6 months, but it could be as short as 3, as long as 18 months. But all kids in short-term residential programs, particularly, are legislatively mandated if you're in foster care or probation to have 6 months of wraparound care upon discharge from a short-term residential program. So Edgewood and Seneca are wraparound programs.
Right. Okay, great. Thank you for the information.
You're welcome.
Since there is no monitoring report, do you have the numbers on how many beds have been, or how many youth have actually been placed at Victor that we are providing the services, or that, we're contracting their
Yeah,
services?
they've met 100% of their deliverables. In fiscal year 24-25, they had over 100% of their contracted units of service delivered, and 92% of their contracted clients. And then in the prior year, they were similarly 97% of their units were delivered and 100% of clients served. So they're a strong performer and strong in terms of all of their performance metrics that they get scored upon that are standard across our contractors.
Thank you. And then this is a question for Kim. So if there was insufficient funding for the contract period to 2027, then and it was, in order to extend it, funds from another contractor were reallocated to extend this to 32. Which contractor was it because they had excess, or did we not want to renew with that particular contractor?
That would probably be a Farah question. Farah?
I can answer that. So there's two factors that led to insufficient funds in the contract. One was in last fiscal year, we had a high-risk client that needed a residential placement. They were not foster care or probation involved, but they had not reached the steps that they needed to reach with the school district. They had they had a different school placement, and we had to work with the school district to get an individual education plan in place for the school district to place in residential. So we were in the unusual place of being the placement agency for this youth who needed a residential placement. So we needed to add one-time funding to the contract to cover the mental health services as well as the board and care. And then the school district picked up that case when we were able to collaborate with them around the IEP. The second one was, there was a contractor, Seneca, who just, we were right-sizing contracts in collaboration with them, who was overfunded in one of their programs in terms of the shifts of client need and of what that contract needed. And we moved it to this contractor who has seen an increase in need, particularly from the school district, but also from child welfare.
So what you're doing is you're backfilling the original contract and extending it at the same time then with the additional funding, or with the new funding?
Yes.
Okay.
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 All right, item number 10. This is A&A Health Services, and this is an amendment with A&A Health Services to increase the contract by $24.5 million for a total revised contract of $34.5 million. This is for a 3-year term, and this is to continue to provide adult residential facility to San Francisco clients placed in 2 locations. They provide skill building to enable them to successfully transform from acute settings to a lower level of care. This particular contract is also subject to approval by the Board of Supervisors. It also reflects a 22.93% increase, annual increase, and that is because of an increase in daily rates and an increase in the possible number of beds that's increasing from 10 to 25. So A&A Health Services provides 12-month rehabilitation services for this adult residential facility board and care. It's a setting for clients from San Francisco ages 18 to 64 that need transition from acute setting to a lower level of care to provide recovery services and help them be more independent when they're discharged. The services are provided at 2 locations, San Francisco Victoria's Place, where they have 46 beds, and San Pablo, where they have up to 25 beds. This particular contract is it comes through our bed ordinance, and it has been monitored, and it does have a score of 4, which is commendable, exceeds standards. Do you have any questions about this one? I have Yoon Jung Kim on if we have any specific program questions.
So I just had I guess, an occupancy question. So the 46 beds at, on Choutwell, do we know with the 100% performance if all of those beds have been occupied?
Yoon Jung, can you answer that question? Ah, great.
Hi, my name is Yoon Jung Kim, Director of Residential System Care with the BF Health Services. Yes, Victoria's Place is 100% full right now. So yeah, there is a wait list right now.
So the wait list, then you don't set, if folks are on the wait list, they don't go to San Pablo, they wait for a bed in San Francisco?
Yeah, as long as a client wants to be placed out of the county in San Pablo. So yes, so they are the same level of care. So yes.
Okay, so the client makes that decision.
Yes.
Okay.
Is San Pablo full?
Second, please.
Is San Pablo full too?
Yes, yeah,
both
absolutely. They're
full.
same level of care. So Victoria House actually place was opened in August of 2022. So the 100% of clients are exclusively actually beds are reserved for San Francisco clients, while San Pablo is the biggest actually the assisted living facility in California, where it has more than 200 beds, but we county actually having a contract only for the 25 beds. So.
Right, so I think I remember we were trying to compete for those beds because we wanted to make sure that we had them if we needed them, right?
Not
that-
for the San Pablo beds.
Not the San Pablo, okay, that was, it must have been a different contract then.
Maybe another type of actually residential facility, but not for the ANA.
Okay.
Okay.
That's it, yeah.
Thank you so much. So I just want to take a step back. I just got word that Rafiki's board has approved the budget. So we do have confirmation.
Great.
Okay,
Thanks.
thank you.
Okay, let's see. Now we are on the 11th item. So this is Community Forward San Francisco, correction to the contract number 10,32803. This is a contract amendment with Community Forward San Francisco in the amount of $22.1 million for a total revised contract amount of $32.1 million. It's extending the term for 5 years to continue to provide medical, respite, alcohol sobering center, and managed alcohol programming. It is authorized under the residential care bed ordinance, and this contract is also subject to the Board of Supervisors approval. So this particular contract does have a decrease in the annual amount of funding, and you will see the reasons stated there in that section. It says, the reason for the decrease is primarily the result of a reduction in Prop C homeless funding that was supporting the managed alcohol program at its prior location, which has now been closed. And it's offset by a 1% cost of doing business increase. So that's why you see that $285,000 decrease, about 4.7%. This particular contract is monitored by the Board of Contract Compliance, and it also received a score of 4, which is commendable or exceeds standards. And I do have, I think, Dara, if you have any specific program questions on this one.
I have none. Yep, none.
Okay. All right. So the item number 12, which is contract 10,33880. This is with Ahern Green Associates. This is a new contract for continuing services with Ahern Green in the amount of $679,084. It is for a term of 2 years and 11 months. And this particular contract is to train substance use disorder primary prevention providers to utilize the Strengthening Families program with youth and families within San Francisco. These services were previously provided by another vendor. There was a little bit of scuttle about that vendor providing these services. I think the program has very specific firm that they allow to do their training, and that's why you see this switch in vendor providers. So this is specifically to teach that program, that specific program. It's a fee for service. It is a sole source because of the requirement by the program owner to have this particular firm provide this service. And it's monitored by the Systems of Care group. And I do have Kelly home here today if you have any specific questions about this program.
I do. There is obviously the contract is just began 2 days ago. And my question then is, why are we putting in more money when we have no data with this? I mean, 2 days ago, not expecting data, but I don't understand.
Sure, if I may. So my name is Kelly Hom. I am the Director of Substance Use Services. So while this contract became effective only days ago, the vendor has been working with us through a voucher process. Because of the proprietary issue, we needed to train people starting July 1st, 2024. So from July 1st, 2024 through September 30th, 2024, this vendor was working with us through a voucher process. And I do have some data on what they were doing since then, or their performance. So they were able to train successfully and ensure that 80 participants were recertified so that they can provide this evidence-based practice. They completed 2 formal trainings of 2 days each with 40 participants. They provided 5 technical assistance sessions with the leaders of the agencies that are participating in the program. They did weekly consultation with the county liaison, the administrator of this grant. Of this contract. We have verbal feedback from the different trainees who participated, and their verbal feedback was very positive. We found that this vendor was very accommodating. We were in a pinch in terms of being able to provide training, and she stepped up and was there and bent over backwards to make sure that all of our individuals could get trained. So just as a little bit of background, if you don't mind, we as the City and County of San Francisco, we have to select an evidence-based practice. We have to name the evidence-based practice in our strategic plan. DHCS has to approve the plan. So we are approved to provide Strengthening Family Program as our evidence-based practice. This evidence-based practice allows us to draw down on approximately $2.2 million of SAPG prevention dollars. So if we don't have the training, then we are not able to provide the evidence-based training and then evidence-based practice to the families. And anyway, we're able to draw down on $2.2 million on that. So any other questions?
No, that helps. So this Ahern Green Associates, we're doing this by voucher. No,
No, that was
that was Golden Bear.
no.
No.
We're working with Ahern Green on a voucher system from July 1st, 2024 to September
That's what I
30th,
meant.
2024.
Yeah,
And so 2 days ago, we entered into a formal contract
That's
with
what I
Ahern
thought.
Green to formalize this.
that's what my question was.
Oh, yeah.
Yeah, they did the staff training on a voucher program, on
Yes.
a voucher, and now
Yes.
it is based on the data that you have. It is now a contract versus
Entering
a
into
voucher.
formal contract. Yes.
Okay, that was my.
Thank you.
So just to clarify, this did not require a solicitation.
Because of the sole source nature, so the evidence-based practice Strengthening Family Program is owned by Carol Comfort and Dr. Whitehead. And I took a screenshot of their page in which Ahern Green is identified as the sole group authorized to implement, train, and do fidelity monitoring of this evidence-based practice called Strengthening Family Program.
So do you know, are they independent of the owners or are they?
They are independent of the.
Okay. Okay. Thank you.
Yeah, good question. Okay, good with that one? All right.
Okay.
So the next two contracts are basically the same types of contracts, and I'll explain a little bit more. So the first contract is 10,36820 is the contract number that was corrected. So these are continuing services in new contracts for our radiology technicians, support staff. So basically just think of this as on-call as needed technicians that the health network can call upon. If they have a staff member out, a staff member on maternity leave or what have you, they have these contracts in place so that they can draw in the staff as needed. So they're both for $5 million. And again, that's just based on an estimated budget amount. I think they spent, well, you can see there about $4.4 million last year. So they added a little bit of cushion to them. They're 1-year contracts. And again, they are just to supplement the staff on an as needed basis. So they're awarding the two contracts to the two highest scoring proposers. There was a recent request for proposals that new solicitation that went out, and these two companies scored the highest. So you have Trifecta and you have Amerigus Healthcare Staffing, both providing the same services. Trifecta is the primary, so they'll call on Trifecta first, and only if Trifecta is unable to fulfill the obligation, and they have a backup with Amerigus to bring the staff in that they need. And that's what these two contracts are for. And I do have Sabrina, I think, online if you have any particular questions about this.
Any questions?
My question is, if in fact they don't need all the money.
Mhm.
Either for trifecta
Mhm.
or for the second one, emeritus.
Emeritus.
What happens? Is it?
It just comes back to the budget. So it's
Okay.
it's billed on an hourly rate basis for each staff member that they bring in. So any money that's left over will just come back into the budget, will not be spent. It's not obligated to them. They know that through the contract language that it's on call as needed. There's no full obligation on the money, but they could go up to that amount should they have a large need. They don't anticipate, utilizing it to that extent. They don't have a lot of vacancies right now. They're working very hard to keep the vacancy rate low. I think there's 7 people out right now. And so this just allows them to quickly backfill when someone's out so that they can continue to provide the services.
No, I mean, that's great. I mean, it's, similar to nursing or whatever.
Yes.
And so,
Yes.
but is it in the contract that if in the fiscal year there is not money spent, it is returned?
Yes, it just would never be committed to them. It's just the $5 million is just like a sandbox around how much they can spend, and it's not all committed to them at once. It's only
Okay.
committed as it's needed.
That was my question too. Thank you.
All right.
I had a couple questions. So just the ranking process, is
Yes.
that, so if the 2 are the top ranking, how, is it based on their cost to?
That's a
business,
good
or is
question.
it
It's a
performance or-
best value solicitation. So they look at their experience of the company, the experience of the particular staff members that they have said they're going to provide, their resumes, and then their understanding of the scope and how the process works. They score that, and then there's another score for the actual cost. And then they combine all of those scores together. They do an interview and interview them. There's a score for that. Then they combine that score as well, and then that gives them the top ranked all the way down.
Great. And then the funding source says city funds. I don't think I've ever seen city funds.
It's just
listed.
general
It's like,
fund.
It's just general fund.
general
Could that?
fund?
could-
Yeah.
okay.
Yeah, good
Just not
point.
be- yeah.
Yes.
For both of them, it says city funds.
Yes. Yes. And so that concludes the monthly report.
Okay. I guess we have a motion to recommend approval to the full commission.
Yes, for those. And then we've got the other 2.
Right.
Okay, sure.
So can we have a motion?
I so move to approve the monthly reports.
I'll second. Is there any public comment?
Is there any public comment in the room? There's no public comment. So that's
Okay, all those in favor? Oh, since it was just the 2 of
yes.
us. Okay. I did have a request though, in terms of the backup papers. I really appreciate the way that this has been done. It's, if, I know they're prepared separately, but if the memo and then no, not that one, the summary of the monitoring report and then the fiscal compliance report, if they can be organized together so that we're not shuffling from the contract monitoring report listing versus the performance monitoring report list versus the fiscal and compliance. It's just easier.
I'm smiling because I just had the same conversation this morning. I have the same struggles of flipping back and forth. And I said, I'm up here with this big mic and I'm flipping back and forth. So I write notes to myself all over the bottom of them. So I can only imagine you guys are doing the same thing. So
Yeah. I mean, but they're very helpful. It's just,
yes, it'd be
yeah.
nice to have it in one place. Yes.
Or just a similar listing.
Yes.
Yeah. As
Okay.
opposed to,
I will take that back.
actually, if it could be consolidated, that'd be even better, but that's okay, as long as they're easy to follow.
Yes. I hear you, and I will certainly continue to work to push for that.
Okay, we can move to the new contracts.
Thank you. The item 4 is requesting approval of a new contract with Agiloft Inc. for implementation, license, hosting, support, maintenance, and training of an electronic contract management system. And just a note for the commissioners, we have about 30 minutes.
I'm sorry, Miranda, I didn't hear you.
We have about 30 minutes.
Okay, yeah. So we have just the two, right?
Yes.
Okay.
Okay, so I'm back again. Kim Baker, Director of the Contracts Office for the Department of Public Health. This is a really exciting project. I wish Michelle Ruggles was here today because this is a project she's been working on for 4 years to try to get a contract. It's in the real world, it's called the Contract Lifecycle Management System. We call it here ECMS. And this is a contract with a company called Agiloft. We went through a formal procurement process, including demonstrations of the software. And this company was selected as the highest ranked firm. They have a very impressive product, and they're going to provide implementation of that product, licensing, hosting, support, maintenance, and training on the system. The cost of the contract is $4.7 million, and that is for a term of 5 years. And that breaks down as $327,000 for the upfront one-time cost to implement the program, and then it will run about $784,000 per year to maintain it. So we're buying about 1,200 licenses, which probably sounds like a lot, but there's 8,000 employees that work in DPH, and we're trying to get as many of the staff that need information about contracts on the system so they have the information more readily at their fingertips. And this will benefit the commission as well, because when you ask us to pull reports and things, the system will allow us a much easier access to be able to do that. So let's go through it. ECMS, that will serve as our centralized department-wide platform that transforms how DPH manages its contract operations. We have currently in the neighborhood of 750 to 850 contracts, totaling about $7.5 billion that we manage. So you can imagine, the struggles just to keep up with all those contracts providers when they expire. So this system's going to help us do that. It's going to have a standardized repository where all our contracts will be located in one place, which right now they're not. Access to track the agreement. So you've heard us talk about this long process these contracts go through, and they're going to different places in the city. So it's also hard just to keep up with where it's at. Now, this system will allow us to track it in real time. And if a business owner or program owner wants to know what the status of their contract is, they would be able to look in the system and see exactly where it's at in time, in real time. It's also going to have a series of workflows that actually move the documents through the system. It has a robust reporting system where we can scrape all kinds of information. We have some AI capabilities to actually pull all sorts of types of reports that we get asked to do. And we really believe that implementing a system like this is going to really increase our efficiencies across our department and help strengthen the contracting oversight. We also have an option to buy a monitoring arm of this program. It was included in the scope, but we don't have it budgeted yet because we need to spend some more time scoping it out. But eventually, if it works the way that we want it to, and we believe that it will, we'll be probably coming back to add that arm at some point in time where we can do the monitoring in the system as well. So we just ask for your approval of this item. Do you have any questions?
Thank you. Any questions?
I guess, no, I think, sounds great. For sure.
We're so excited about it.
And I'm hoping they'll have two, depending on what you want. Let's say I want to look at, not me, but you want to look at XYZ contract.
Mhm.
They'll have drop downs of, I want to see budget or number of clients or
Yes.
whatever. So
Yes.
easy.
Yes.
My only concern, not that we have to worry about it now, but in the performance monitoring,
Mhm.
which I think is great, but I would hope that that the performance monitoring is not solely going to be data-based,
Got
but
it.
there is human
Yes.
interaction
Yes.
with as well.
Yes, our director feels the same way.
Okay, good. Okay, I just gives me pause. That's all.
Yes,
Thank you.
yes.
Just, I don't know if this is an issue, but since the contracts for all the vendors that are going to be in this new system encompass all of the kinds of contracts that both, I guess, the hospitals, the clinics, as well as other operations.
Uh-huh.
Is there cybersecurity issues and are there HIPAA issues?
So the cybersecurity issues, we go through a pretty rigorous cyber review. Agiloft has already submitted their SOC 2 Type 2 documents, and Liz Kruger is here. She is our IT program manager, and she is going through also questionnaire we have a whole AI group now that's looking at how we're going to use AI and what the plans are for that. So it is getting a very careful review by all of those specialists right now to make sure that everything will be in compliance.
And no HIPAA related issues?
No
that we're
HIPAA
aware of?
related issues. No PHI, no ties to Epic.
Okay. And then when do we hope that this will all be online?
It's going to take about 10 months. The contract will start up around the first of the year, and it'll take us about 10 months to do all of our planning, developing, implementing, training. So the schedule right now shows October of next year when we should be going live.
Great. Well, it's very exciting. And just hoping then we could get a report on the performance of the new
Yes.
platform a few months after it's been implemented. So maybe by the end of next year,
Yes,
beginning of 27.
absolutely. Be happy to do that. And we do have a great IT project manager. She definitely keeps us on our toes. She makes sure every deadline gets met. So I'm sure she'll be driving us pretty hard to the finish line.
No, I can't imagine how excited folks must be to
Yes.
have this in place. I mean,
Very.
It's just something that I think is way past due. So glad
It
to know
is.
that. Yeah.
Yes, thank you.
I think it would be really interesting too, at least for our education purposes, is once it is in place and going live,
Mhm.
et cetera, that for this committee, we have a little demonstration.
A demo? Okay.
Yeah, I think a demo would
That'd
really
be
be
fun.
Okay.
Yeah.
Okay.
a
All
good
right.
idea.
You got it. Okay.
So do we have a motion to approve?
Oh, sorry.
That's okay.
I so move.
Second.
All those in favor?
Yeah. So we're good. Yeah.
All right.
Good to go.
So we can, I'm sorry, I should ask for public comment as well. Is there anyone in the room? No public comment.
Okay.
So moving to item 5, which is request approval of a new agreement with Parts Source Inc. to acquire access to purchase OEM parts at a discounted price and as needed part repair services and training credits.
So that is Naughty, and he's online.
Thank you for reminding.
Hi, good afternoon. First, thank you for accepting me online. My apologies for not being able to be there in person due to a medical emergency I had during the weekend. My name is Nader Hamoud. I'm the Associate Chief Operating Officer for the San Francisco Health Network. Part of my responsibilities is supply chain and biomedical engineering, as well as capital equipment. So all of the medical equipment within Department of Public Health, they require maintenance regularly, whether it's in periodic basis or as it fails. And as of today, when we buy parts as a replacement parts for repairing these equipment, it's not tracked, it's not data is not collected, and we don't see any trends that can help us in better planning and strategizing the life cycle of our equipment. This proposal that we're asking for is kind of a mini group purchasing organization. PartSource negotiate on behalf of the hospitals that are part of their group, better pricing for parts from all the manufacturers and all the parts providers in the market. So by us participating and paying the monthly fees to them, we will be able to access their discounted price. So these parts that we will buy, instead of buying, for example, an X-ray tube that usually costs $30,000 if we're buying it on our own, if we buy it through this part source program, it will be $20,000. So the calculated savings that, in addition to the fees that we're paying, the estimate that we will be saving at least 10% of how much we've been spending today on parts. Again, today we estimated that the number that we would need to buy parts is around a bit less than $500,000 a year. That's included in the budget, but it's not committed to the vendor. It's just for us to be able to use that budget to buy parts as needed. But what's committed is the monthly fees. That's around $9,000 a month.
Okay, thank you. Any questions?
Are these all new parts versus any
Yes.
kind of, they are all new, not like replacement used parts?
Yeah, it's practically up to our discretion to decide what we need to buy. But if we're buying new parts, then it is going to be new parts. It's not like going to a third party that's refurbishing parts. No.
Thank you.
Okay, that's good news, and hope it's more than 10% savings. But
Yeah.
We hope so. That's the minimum. Yeah.
Mhm.
okay, is there a motion to approve? Recommend approval?
I so move.
I'll second. Any comments? Public comments?
Thank you so much.
There's no public comment,
Okay.
so we can move to the next item, which is emerging issues. Any emerging issues from the commissioners?
None here. Any emerging issues?
And how about any public comment?
I don't think we need that on the emerging issues. Yeah. Okay.
The next item is consideration for adjournment.
Is there a motion to
So move.
second?
All right, thank you.
Okay. Thank you.